This video details the brain changes in Alzheimer's disease using PET scans. Our focus is comparing normal PET scans with those showing the reduced metabolic activity characteristic of Alzheimer's in the cortex and hippocampus. Our learning objectives include understanding the PET scan signal, identifying normal versus Alzheimer's FDG PET patterns, linking reduced activity to brain region dysfunction, and summarizing major brain changes like amyloid plaques and tau tangles. Normally, the brain continuously uses glucose to support cognition, shown as bright areas on an FDG PET scan, indicating strong metabolic activity. Normal patterns serve as the baseline for detecting regional metabolic loss. PET scans utilize a radio tracer to visualize metabolic activity. In FDG PET, a glucose-like tracer highlights cells with high energy demands. The scans map regional cell function and should be interpreted alongside clinical context for diagnosis. A normal FDG PET brain exhibits strong and relatively symmetric uptake in the active cortex. This high cortical activity indicates healthy synapses and communication networks, though clinical context remains essential. Alzheimer's PET scans typically reveal lower FDG uptake, indicating hypometabolism in the temporoparietal association cortex. This pattern helps differentiate Alzheimer's-type neurodegeneration from other dementias. Hypometabolism signifies that a brain region is using less glucose, reflecting impaired synaptic activity and neuron stress. In Alzheimer's, this reduced metabolism connects biological changes to symptoms like memory decline, often appearing before structural tissue loss. The cortex, responsible for higher functions, is a vulnerable region in Alzheimer's. Pathology spreads through cortical networks, leading to dysfunction that explains symptoms extending beyond memory. PET reveals this functional weakness, even if unevenly distributed. The hippocampus, vital for new memories, is affected early in Alzheimer's, causing difficulty storing recent events. Hippocampal injury is linked to forgetfulness and atrophy visible on MRI in many patients. Comparing normal and Alzheimer's PET scans shows a clear contrast. Normal scans exhibit strong, balanced cortical metabolic signals. Alzheimer's shows reduced signals in memory and association networks, forming a characteristic regional pattern. The posterior cingulate and precuneus, central hubs for memory, often show early metabolic reduction in Alzheimer's patterns. Failure in these hubs disrupts communication across distant cortical regions, contributing to cognitive slowing and disorientation. Temporoparietal cortex hypometabolism is often bilateral in Alzheimer's FDG-PT. This area integrates language, spatial processing, and memory cues, so reduced activity relates to naming, navigation, and complex task impairment. Frontal cortex involvement increases in later stages of Alzheimer's, impacting planning, judgment, and social behavior. This later dysfunction contributes to poor decision-making, and PET may show wider hypometabolism as the disease advances. FDG-PED measures functional neurodegeneration and glucose metabolism. Amyloid PET detects amyloid plaque burden, a biological hallmark. Interpretation requires combining amyloid status with cognition, age, symptoms, and other biomarkers. Tau PET detects abnormal tau protein deposition, relating more closely to neurodegeneration and symptom severity than amyloid. Tau imaging can help estimate disease stage and regional burden in clinical scenarios. Brain shrinkage, or atrophy, is a visible consequence of long-term neuron and synapse loss. This atrophy often affects medial temporal structures, like the hippocampus, crucial for memory in the disease. Alzheimer's disease disrupts synapses, the contact points for neuron communication, leading to synapse loss. This weakens signaling, reduces metabolic demand, and is closely linked to cognitive symptoms. Amyloid plaques are abnormal clumps of beta-amyloid protein outside neurons, a classic microscopic feature of Alzheimer's. Plaques can disturb nearby synapses and accumulate long before dementia symptoms appear. Tau tangles are neurofibrillary tangles, formed by abnormal tau protein inside cells. Tangles interfere with internal transport, impairing cell health, and eventually causing neuron death. Tau spread matches clinical progression patterns. Neuroinflammation involves microglia and astrocytes responding to plaques and tangles. While initially protective, chronic inflammation can amplify damage, making Alzheimer's a network disease rather than just a plaque and tangle disease. Neurovascular coupling links active neurons to necessary blood supply, oxygen, and glucose. Alzheimer's can disturb this regulation, meaning reduced PET activity reflects combined damage to biology, connectivity, and tissue health. Mild cognitive impairment, or MCI, is an early clinical risk state where cognition is weaker, but independence is partly preserved. PET biomarkers can help determine if Alzheimer's biology is present, though not all MCI progresses to dementia. Mild Alzheimer's often presents with recent memory loss and repeated questions. PET changes usually focus on memory and association networks. Early diagnosis is key for care planning and treatment discussions. In moderate Alzheimer's, disease affects language, orientation, and complex daily tasks. Metabolic reductions become widespread, and behavioral symptoms may appear. Care needs increase as coordination fails. Severe Alzheimer's involves major neuron loss and loss of independence, severely impairing communication and mobility. While PET may show broad hypometabolism, care focuses on comfort, safety, and family support. Symptoms map to brain regions. Hippocampal damage causes rapid forgetting. Temporoparietal dysfunction affects language and navigation. Posterior cingulate weakness disrupts memory networks. Frontal involvement impacts judgment and behavior. PET findings support diagnoses when symptoms and imaging are uncertain, helping differentiate Alzheimer's from other dementias. Amyloid PET can determine eligibility for anti-amyloid treatments, but biomarkers must complement clinical judgment. PET scans are not screening tools. False positives, mixed dementias, and age-related changes can complicate results. A specialist should interpret PET findings within the full clinical context, considering costs and radiation exposure. In summary, normal FDG PET shows strong activity, while Alzheimer's reveals reduced activity in key memory networks. This reduced activity links to tissue damage from amyloid plaques, tau tangles, synapse loss, and inflammation. Thank you for reviewing the brain changes in Alzheimer's disease and the role of PET scans in understanding its progression. The references listed are the sources used for this educational video.